In this quick tutorial, you'll learn deep tissue treatment for neuromuscular low back pain. Chronic postural strain, overuse of lower back muscles, or injury can cause muscular hypertonicity, either throughout the entire lumbar region or in individual muscles. The muscles of the spine become hypertonic and develop trigger points that cause pain and muscular dysfunction. Chronic muscular hypertonicity can result in dysfunction of functional spinal units and have far-reaching effects as numerous spinal disc problems. As usual, begin with an assessment to rule out more serious pathologies that need referral to another health professional. Start with light massage techniques to assess the tissues, apply lubricant, introduce your hands, and prepare the client for the treatment. Gradually apply more pressure to reduce superficial muscular tension and increase circulation. Massage with long gliding strokes parallel to the muscle fiber direction. Cross-fiber techniques sweep diagonally across the primary fiber direction of muscles. Work all of the spine in the direction of bottom to top. As treatment progresses, increase your pressure to access the deeper tissue layers and reduce tension throughout the deep muscles. Use deep longitudinal stripping, cross-fiber frictions, static compressions. Start with a broad contact surface of pressure, especially if there is a greater degree of tension in superficial muscles. After relaxation of superficial tissues, work more specifically on tight regions of the spinal erectors. It is not effective to use broad contact surface in this area. Apply the stripping techniques with a small contact surface pressure. In this lesson, I am using deep tissue tools, but alternatively, you can use your fingertips and thumbs. The next is deep stripping on the QL. If the client does have trigger points, they are usually found at the attachments of the QL. Start from the iliac crest. Now, work the upper part of the gluteus muscles. To release trigger points, use static compression and pin and pull methods. Use a small contact surface directly on the trigger point. Pressure maintained for 8 to 10 seconds is usually sufficient to achieve a reduction of muscle tension. Apply heat to the lumbar spine for 7 to 10 minutes. You can spend this time accordingly with your client's needs, massaging other parts of the body. In 10 minutes, you can see that back muscles have much less muscle tone. It's time for real deep tissue work. Clean excessive oil from the client's skin. To keep the lumbar region in a partially flexed position, you can place a pillow under the stomach. Deep stripping in lamina groove. Your goal is to release the deep paraspinal muscles. There are 3 major muscle groups in this group: the semispinalis, multifidus, and rotator muscles. Releasing the deep paraspinals will improve function of functional spinal units, increase circulation and innervation to the area, reduce painful symptoms, and increase ROM. In fact, unaddressed deep muscles of the back are the primary reason that chiropractic and osteopathic spinal manipulations have such short-term success in treating spine pain conditions. For longer-lasting relief, first release the deep paraspinal muscles, then do spinal manipulations. Numerous intrinsic muscles of the spine are difficult to treat unless deep specific work with a small contact surface. For better results, I use pressure tools. The tips of the tools are much smaller than my fingertips. I can go deeper and work more specific, which is not possible with my thumbs and fingers. Use deep longitudinal stripping and frictions in the lamina groove. Work away from spinal processes to separate muscles from the spine, reduce myofascial adhesions, and release tension and possible trigger points in deep paraspinals. Repeat short stripping movements on any areas where increased muscle tension is palpated or the client reports greater tenderness. Work in the lumbar region to reduce adhesions and increase pliability of lumbar fascia. It is important to make the second pass working really deep around the iliac crest to release QL and upper glutes. If these muscles are hypertonic, they can alter normal biomechanics in the lumbar pelvic region and sacroiliac joints. Finish treatment with active stretching, advice on stretches, and icing as home care.